So one of the issues as we move forward to doing large panel genomic testing is that we're going to start to find genomic abnormalities where we may not have clinical trial data. And it may be that you might find something that leads to a treatment in another disease type. So for example, looking at pancreatic cancer and you find a BRAF abnormality. And we know that in certain cancers, lung cancer, melanoma, something like that, if you give a BRAF inhibitor, you get very good responses. What happens to that patient? And what happens at the moment in the NHS is, in some senses, the oncologist will go forward and they'll speak to the drug company and say, is there some way of accessing this? Or we'll go to NHS England and say, can we do an individual funding request? Can we get access to this drug for this patient? Because we think that they might benefit. But we're extrapolating from other data and we don't really know. So what the Determined study is doing, it's led by Matt Krebs out of the Christie, working with NHS England, is to say, well, let's do this in a rigorous manner. So we need to identify these patients, so it's not done within Determined, it can be done within the Genomic Laboratory Hub structure or other genomic profiling. Find these patients, and when there's a licensed therapy available, rather than doing it through a compassionate access, it's done through the Determined study, along with lots of translational science, so there'll be biopsies and blood samples to track how they're responding to treatment, how they're becoming resistant to therapy. Importantly, it is married up so that if we see a cohort of patients who are all responding, so say we treat our 30 patients with pancreatic cancer and a large number of them, half of them respond, automatically that will be looked at by NHS England to go forward for funding.